Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. Well, today we explore oral health and my guest is Dr. Thomas Lokensgard. Now, Dr. Tom is a biological dentist and he is a holistic biological dentist, a naturopathic physician, anti-aging health professional. He's a member of many organisations around oral medicine, toxicology, biological dentistry, anti-aging, and he has written a wonderful book called Matters of the Mouth. Look, this is a subject, obviously, that I've been passionate about all my professional life, and it really is the missing link in so many people's health journey. It's always astounded me how often I've seen patients with complex medical conditions, often late stages in cancer, who have come into the practice and have never had a thorough, comprehensive oral exam. And if you stay tuned, I'll just repeat what that involves at the end of the episode. But it is more than just a 10-minute checkup with your dentist or that you're not in any dental pain. This is a really big and important issue. It is the missing link in healthcare, and that's why I was looking forward to speaking to my guest. I hope you enjoy this conversation I had with Dr. Thomas Lokensgard. Welcome to the show, Tom.
Well, thanks for having me. Thanks for having me, Dr. Ron.
Tom, you've written this wonderful book, Matters of the Mouth, and it is absolutely music to my ears. We share a common interest there in oral health.
We do.
And I think because of our more holistic approach, we share an interest in general health as well, and some big changes are occurring or will be occurring by the time this episode comes out, are occurring in the US. And one of those movements has been championed by Robert F. Kennedy Jr.
Make
America Healthy Again. And I think it's so interesting to see the mainstream press narrative dismiss him as an anti-vaxxer, a woman abuser, or someone that drives around with dead animals on it. It's just absurd. And yet he's the only one that I think have been speaking with any degree of clarity on the issues, particularly on health. What's your view of his initiative, Make America Healthy Again?
Well, I've met RFK Jr. at the Truth About Cancer conferences, and I've met him, I've talked to him. He's a great guy. And what my initial hope is that I would see a Trump, Kennedy, Vice VP and presidential campaign, but I knew that they were both strong-willed, strong-minded people, and I didn't know how far to the left Robert Kennedy Jr. still is or was. And as it turns out, he abandoned his party. Although what he said was, my party didn't, I didn't abandon the Democrats, they abandoned me. But his whole career, his whole life career has been Make America Healthy Again. And he's just brilliant in that field. So we're going to be carrying some of our products and our books in the Make America Healthy Again arena.
Right. So, there's a lot going on there. I know he's targeted a lot of things, really. The organisations like the CDC, Centre for Disease Control, the NIH, the FDA. Oh my God, the FDA and
The
the
Food and Death
USDA.
Administration.
Pardon?
The Food and Death Administration.
The Food and Death Administration and the US Department of Agriculture all need a good broom swept through them. There's no question about
Yes,
that.
they do.
But your focus and my focus professionally has been on the role of oral health in overall health, and I think we both would agree that it's the missing link in healthcare, the black hole, if you like, of healthcare. How does functional dentistry and integrative medicine, how are they related? How do you see that?
Well, they look at the whole body, and they look at disease. Disease starts in the mouth, and that has been, I don't think it's been recognized as a tenet until just really lately. And so, I got frustrated in dentistry just by doing drill, fill, and build dentistry, where I was just plugging amalgams and doing root canals, and I didn't believe in it. And then I saw a lot of complications from it, particularly with root canals. So, but it occurred to me that dentists don't work together like they should, and physicians don't work together like they should. But one patient of mine said to me, she goes, Tom, when we were in medical school, we were taught that everybody's different. We all have different, genetics, et cetera, different effects. And she said, then when we get out of school, everybody treats everybody the same with pharmaceuticals. So and I learned from another friend of mine, you cannot pharmacologically intoxicate someone into health, which makes a lot of sense, because then they have to recover twice.
Yeah. Well, I have heard the statistic that the third biggest killer in America is actually medication taken as prescribed.
Yes. Yes.
Behind heart disease and cancer. That shocks a lot of people, and I think a lot of physicians are oblivious to it. But that is the statistic, isn't it?
Right. Well, the biggest three infections or complications and situations in medicine start in the mouth. One is dental decay. The second is gingivitis. Dental decay is a remineralization issue. And gingivitis is it's like the way I describe it to people is that your tooth has, around the tooth is a little collar, like a sweater, like a sweater collar on a sweater. And then the bacteria get in there and they turn the gum tissue red. That's the second biggest disease, gingivitis. But that's reversible, as you well know. And we can talk about that later, about how you can reverse gingivitis. But then the next one is periodontitis, and that's an actual infection where the disease goes into the systemic circulation with a bunch of microbiomes, or from the microbiome into the blood vessels and into the organs, especially in the brain, and where you have infected root canals.
Mm-hmm.
So that interested me, is that the top three disease states in the world are all dental. They're all oral. And that's been dismissed for years.
Yeah. I mean, to me, I think it's interesting to see how health practitioners who are assessing their patients' health trivialize or completely ignore the oral health component. I mean...
Well, they don't understand it.
They don't understand it. I think they relate it to pain. I think one of the if you don't have pain, to many health practitioners, if you don't have pain, then you don't have a dental disease.
Right.
It's just if we diagnose cancer like that, that would be really an interesting way of going, wouldn't it?
That's true. So the oral microbiome and the oral health component is it's the major important issue, in my opinion. Now, that is not to diminish or belittle any of the other symptoms and disease states. But basically what happens, I think, in all diseases, and I get this from Nathan Bryan, who's a nitric oxide specialist, is that the first thing that happens is in any disease state, in any disease where an organ becomes diseased, the blood flow is diminished. That diminishes the oxygen potential, and that diminishes the voltage. And then it diminishes the immune system comes in and tries to take over. But every major disease state acts that way.
And how does put dental decay into that model?
Remineralization. Well, like I said before, that's a remineralization issue. That would be more of a gingivitis or periodontal issue.
Okay.
The microbiome has a lot to do with dental decay, and the acidity in the mouth has a lot to do with dental decay. If you're below 5.4 pH, and if your listeners know about the pH scales, 0 to 14, 7 being neutral. If you're below 5.6 or 5.4, then you're going to probably not remineralize well. But there's another little known system, at least little known to the dentist, and I'm sure you probably understand this, but there's this Steinman and Lenora, are two doctors who capitalize on the dental fluid transport system. So there's an actual system. It pushes micronutrients and minerals toward the surface of the tooth, but the pH has to be in the alkaline range, or at least past 6.7. So you get this back and forth, and the body's always trying to in the blood, trying to equalize the equilibrium in the blood to keep the pH between 7.35 and 7.45 in the blood.
Yeah, this is the work out of Loma Linda, isn't it? And they've been doing that for many, many years. And it basically, for our listener, inside the tooth is this blood vessel, the pulp of the tooth, and there's a fluid movement out of the tooth, like almost. Pardon?
Dr. Ron, there's 3 miles of dental tubules inside the pulp tissue, or inside the tooth. Yeah. So what do you think happens when you do a root canal and you block those? You block those dental tubules, and then the blood vessel the blood can't get in there. The nitric oxide wanes, and the voltage drops. And when the voltage drops, if you're familiar with Jerry Tennett's work, when the voltage drops, all the bugs wake up, and they're hungry, and they start having you for lunch or whatever, your tooth or your brain tissue or whatever else it is.
Yeah, so that's interesting, isn't it? That the fluid movement is out of the tooth, kind of keeping it, stopping the bugs from getting in and the acid from getting in.
Moving the mineral out to the outside of the tooth to prevent decay. Now we have a product called Silidin or silica drops. And what I've seen is we take people with just incipient decay in the enamel, and we film it, and there's really no other problems. But these are like in children or in some young adults, and we give them this silica drops, and within 6 to 8 months it remineralizes because it reverses the flow of the dental fluid transport system, which has to do with carboxamyl. The term is carboxamyl.
Don't go into too technical an area there.
That's fine.
Well, you got to get the book, right? Okay. You've mentioned gum disease too, and tell us about that in the nitric oxide model. There, you say that's more applicable to gum disease. Talk to us about that.
Well, it's the same principle. When your gum tissue becomes in your let's say you have periodontitis. If you have periodontitis, you have a bona fide infection in the tissue with an inordinate amount of bad bacteria that are causing the situation and the problem. So what we do then is we do a genetic test called, and I can't remember the name of it right now. Mm-hmm. That's like. It's an 11-point dental biome test,
right?
And then
to identify the microbes,
to identify the chlamydia, bacteria, and all those kinds of stuff. Yep. So, but it's the same thing. The blood flow, basically, the nitric oxide is lessened, especially if you're a mouth breather. Because when you and that's a huge problem there too. Not to divert, but I guess I will.
No, that's good, because if you're talking about nitric oxide, then mouth breathing is nasal breathing is an important part of nitric oxide production, isn't it?
Right, right. So nasal, well, that's because your nitric oxide is made primarily in your mouth and in your paranasal sinuses. And
Mm-hmm.
so if you're doing the mouth breathing, and part of my dental practice was in expansion orthodontics. We do a lot of orthodontics.
Mm-hmm.
So, but where were we?
Nitric oxide production, mouth
Okay.
breathing.
So if you are a mouth breather, you are then your microbes are going in your stomach, and your oxygen levels aren't going through the nose, through the sinuses, the paranasal sinuses where the nitric oxide is made, and then it gets dumped into the stomach, and then it goes off into the other arterioles. They say there's 60,000 miles of blood vessels in our bodies. I don't know who's mapped that
Who
out.
measured that? Yeah. But I
And
think
it's not.
the important thing about nitric oxide, though, is not only is it a really important regulator, but it's also antimicrobial, isn't it?
Yes.
And that if you're a mouth breather, you're missing out on a lot of that,
Right.
the
Right.
benefit of that, aren't you?
That's exactly right. And nitric
Mm.
oxide is probably the most important element, that, to the human body, because without oxygen, you die. It's just that simple, and that's the carrier. The nitric oxide is made in the endothelium, as you well know, and then it heads into the arterioles and into the organ systems, and it brings its function is to bring oxygen into the organs, right?
So with periodontal disease, you made the point that the gum should be like this collar around the tooth, and if that collar becomes loose or there's a pocket down the side of a tooth, you end up with bacteria in this pocket that starts to produce problems. And we talk about toxins. Do you think that deep periodontal pockets you should extract the tooth? I
No,
mean,
not no. You should try to fix the periodontal pockets first. It's a do the DNA test for the microbiome in the mouth, and then go to a dentist who's a holistic dentist. And what we did, Ron, is we treated it with ozone.
ozone.
Ozone is
Okay.
like oxygen on steroids, and so you clean and scale and root plane the teeth, or you
Yep.
can use Lanap surgery, which is a pretty good way to go. And then you apply ozone, and then we also apply have people take gut microbiome, different microbiome, different. So basically, yeah, ozone is like oxygen on steroids, and ozone will fix and will remedy. Or you could if you have to extract the tooth, you could do a PRP procedure. You can do an extraction, clean out the dental fiber, all the fibrous tissue in the socket, and then take a blood draw from the patient, spin it down, get the PRF, protein-rich fibrin, put it back in the socket with ozone, and then let it heal.
Hmm. Hmm.
So,
Yeah.
so the answer to your question is no. You don't have to extract the tooth necessarily. But if you've got a cavitation, which is another problem, cavitations can sit and be be asymptomatic for years, and from extracted teeth where the roots weren't cleaned out, and they became infected due to the change in voltage.
This is an important point too, isn't it? That people think, oh, just pull a tooth out. It's pain. If you've got good anesthesia, it shouldn't be painful. Just pulling a tooth out, very basic. But actually, there's much more to it than that, isn't it? It needs to be, you've mentioned thoroughly curating out. You've mentioned
Right.
the application of ozone. You've mentioned, people may have missed that, Tom, PRP, because it's a really nice thing that dentistry now uses.
Right.
Just say that again slowly because you said it very quickly.
Okay. When you extract a tooth, because
Yep.
it's full of microbiome, and it's full of the micro anatomy and the microorganisms, I should say, that cause infection. So if you don't clean them out, they live there, and because there's no voltage in there in the tooth socket, they'll remain, and they'll keep producing pus and et cetera, and they'll turn into, it's like a slow burning fire that you don't know about. So then you have to clean it all out, ozonate it, clean the socket, and then take a blood draw from the patient, which is the PRP, called protein-rich plasma, or PRF, protein-rich fibrin, which are the stem cells, the stem cells of your blood that when they spin them down, that's the blood. It's like a blood clot, and you stick it back in the tooth, ozonate it, sew it back up, so you're preventing any kind of further infected process.
Yeah. And that is, for those that may not have quite heard it then, you take a blood sample from the patient themselves,
right,
put it into a test tube, spin it in a centrifuge for a couple of minutes, and you end up with this, like a natural Band-Aid from your own body with immune cells in it. I mean, it's just a wonderful, yeah. You've mentioned electrical potential a few times there, and I love that because, let's face it, we are walking electricity. Every cell in our body, every nerve, every cell, it's all about electricity, which takes us... Go on.
Well, I was going to say, we know that God has created a biochemical and a bioelectrical. The human body is bioelectrical and biochemical.
Yes.
And I think most physicians don't understand that. And I think hardly any dentists understand that, except for the holistically trained ones.
Yeah, and let's face it, the biochemistry we couldn't wait to get rid of once we passed that in undergraduate dentistry or medicine. That was in first or second year, and thank God I finished with biochemistry. I don't have to worry about it anymore.
Yeah. Well,
in fact, that's how the human body happens to work.
I majored with biochemistry.
Oh, really? Wow, interesting.
And then in my first year of dental school at the University of Minnesota, I remember this biochemist saying, in America, we'll never have micro or macronutrient deficiencies because in America, we have vitamin-enriched bread like Wonder Bread.
Yes.
And I'm like, seriously? And I'm paying all this money for dental education. I'm thinking, okay, that makes sense.
Well, Tom, I think you'd agree that, and this is probably true of the American Dietitians Association, it's true of the Australian one, that they see it very much in macronutrient terms. And a carbohydrate is a carbohydrate, a fat is a fat, a protein is a protein. As long as you're getting enough macronutrients, vitamin or nutritional deficiencies really are very, they're only trace elements. They're only little stuff that doesn't make much difference.
Exactly right.
Go on.
The main part, the body is both biochemical,
yes,
and bioelectrical. Yep. There's connective tissue meridians, as you well know, in the body, connecting each tooth to an organ system. So there's a very famous study done by University of Switzerland, Thomas Rau. Have you heard of this one?
Yes, I have. But remind our listener.
Okay, this is a very important study because I was involved with the Truth About Cancer conference, and it was a very small study, but he was a physician, an MD in Switzerland called the Paracelsus Clinic, and he was dealing with women who had breast cancer. And on the ipsilateral side, same side, they had a meridian problem, and they had an infected second molar. 98% of them had, because there's a voltage channel that runs from the second molar down to the breast. And if you look at, and so 98% of those women that Thomas Rau looked at and evaluated had breast cancer.
Mm. And this is coming back to what we started the conversation about, that when people attend cancer clinics, when people are looking at complex health problems, the mouth is often completely ignored.
Yeah. Well, again, like I said, it's because they don't understand it. But, like I said before, the nephrologist doesn't know what the cardiologist is doing, doesn't know what the dentist is doing, doesn't know what the oral surgeon is doing or has done, and they just don't have. It's a time constraint issue, I think, and possibly they just don't understand the connection. We've tended to compartmentalize the human body, and that's not the way God made it.
Mm. But this bioelectrical issue, which is largely ignored completely, given, but it kind of brings us. Pardon?
Except for traditional Chinese medicine and Ayurvedic medicine.
Yes,
that's
interesting. Yeah.
Go ahead.
Yeah.
I'm sorry, I didn't mean
which has actually stood the test of time over thousands of years, but that's by the by. But dentistry throws up some interesting challenges to the bioelectrical system, doesn't it? Because of its use of dissimilar metals in the mouth.
Yeah, early on, I just thought, well, what am I doing here? I mean, I'm doing root canals. I just felt like I felt what I was doing was unimportant. But then I found out it was dangerous. And then back in the day, you mentioned mercury and fluoride and things like that. In dental school, the instructors would tell the hygienist to polish the mercury fillings to make them look nice and shiny. Because they didn't figure that once they were intact into the tooth, there would be no destruction, no damage. So, but we all know that if you broke a thermometer and spilled it, you'd have to get a hazmat team out to clean up the toxic mercury. So I quit using mercury years ago, and then I got into thinking, well, how does that affecting me? Because if I take out a mercury filling, which I started to do, I had to go get training, and I got training at the Holistic Dental Association. And here's something that your listeners need to know. If you're looking for a biological dentist, you need to go to the AMA. They need to go away from the AMA and away from the EDA and away from the American Academy of Endodontics, but go to the IABDM and the HDA, the Holistic. This is all in the book too. The Holistic Dental Association, the IABDM, and the IAOMT. Those are the organizations, and then the A4M, because I was boarded in the American Academy of Anti-Aging Medicine, which for me brought it all together.
Yeah. Now the IAOMT, what is that? The International Academy of Oral Medicine and Toxicology.
Yeah.
They talk, and this is actually really an important point, because removing this toxic material, mercury, has implications not just for the patient, but considering the dentist is doing this all the time, it even has greater and staff has even greater implications for the staff. And I know the IAOMT has smart protocols, safe mercury amalgam technique. What are some of the things that patients should be checking their dentists, or what are some of the things dentists should be checking they're doing?
They need to look and see how many mercury fillings they have, first of all. And some people will have mercury fillings underneath their root canals. So you have to go to an IAOMT trained dentist, and the SMART protocol is just kind of a catcher-up type procedure that gets them caught up, but you need much further training. So you need to use vacuum pumps and specialty suctions and rubber dams, nasal hoods, things, and facial masks. Which is the only logical place to use a facial mask. Otherwise, they're pretty lame. But the IOMT has a good fundamental program, like you said. The Holistic Dental Association has a lot of training, and the IABDM, which I was certified in, has also some good protocols. But you need to. I mean, we work in Dr. Ron, you know that we work in the most toxic profession on the planet.
I do know that. It's sobering.
And so if any young dentist out there, or any patient who has a dentist who is going to be drilling out your mercury filling, think twice. Make sure you're working with somebody who has been trained properly to do it.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. I saw, Tom, there was an article came out a few years ago. I'm sure you've seen it too, and people can Google it. It's called, if you look at the 47 worst jobs for your health. Did you see that study? It came in Business Insider 2020, but just Google it, 47 worst jobs for your health. And it's the US Department of Labor looking at 970 jobs in America. So you can imagine they cover quite a few jobs.
Yeah.
And guess which come out, and they use 6 criteria: exposure to contaminants, microbes, radiation, being seated, and these, they don't even factor in stress. And dentistry of 974 jobs comes up in the 1 and 2. And 2.
I believe
worst jobs for your health, and they doesn't even factor in mental stress.
Yeah, which is, we both know, is enormous.
Enormous.
I had a day where I had on my schedule, we had 9 chairs. And I had a day where I said, wait a minute. I said, this is going to kill me. And I said, instead of counting the patients, there was 83 patients.
Oh, my God.
And I had a great staff. I had great staff, but it was just drill, fill, and bill. Throw a patient in a 10-minute slot when you've got 8 other patients. And I went up to Melanie. I said, Melanie, if you don't take some of these patients off you're talking about stress. If you don't take some of these patients off my schedule, I think I'm going to be done tomorrow. And she goes, oh, okay. And so she promptly removed some of the lesser patients. Not that they were unimportant, but just that how much, damage can you take stress-wise?
Well, that's such an interesting, you and I are an exact contrast there, Tom, because from very early on in my career, I recognized that 4 days was the max that I could do, and long appointments was the only way I could do it. So I would rarely see more than 12 patients a day. If I saw more than 15, that was terrible, because it meant short appointments, and I needed time to recover, to be focused. So that is a nightmare. 9 chairs, 83 patients. The fact that you're still sitting here talking to me at this stage of your lifetime is a test. You changed but you changed from that. You didn't continue to do that, did you?
Correct. And that was toward the end of my career. But imagine doing that for 30 to 40 years, plus being exposed to all the toxic elements. And
Right. So let me get this straight. You painted that picture of nine chairs and all these patients. When did you stop doing that? You've been in practice, say, for 40 years.
January 2023.
Wow. Now, isn't that interesting, Tom? Because we both retired from clinical practice at the same time. But up until then, you were running a practice with 9 chairs and all those patients.
Yeah.
Wow.
And some days we had 2 doctors, but like you said, I worked Monday through Thursday, and I took Friday off. But still, some days I'd come in on Friday to do some cleanup work and whatever else.
Gee, Tom, that's mind-boggling to me. I now focus on dental practitioners and health practitioners' mental health, mental fitness training, I call it. Well, it's a huge problem. We just saw a report in Australia from the Medical Association, which said between 65 and 75% of medical practitioners and medical students are facing burnout, which is characterized by disengagement, feeling ineffective, and exhausted. So mental health of health practitioners is a major issue. But we digress, Tom, we digress. Let's get back to another thing that's interesting to me is fluoride. And I know Robert F. Kennedy has put that on the agenda. And I think you would agree that if you went into into the Dental Association's meeting and said, I'm against fluoride, a dentist would look at you and think you were totally insane. This guy must be a complete nut. Fluoride is the best thing that's ever happened. But I don't agree with that. What do you think?
First of all, fluoride doesn't do anything. It doesn't really make the enamel. It makes the enamel a little more brittle. But the same guy who was talking about the Wonder Bread, the biochemist, because I majored in biochemistry in college, I worked with him in my first year of dental school, and we did an experiment whereby we took this compound called Durafat from England. It was a paint on fluoride. And we painted it on, and this is back in the days when school was on a quarterly basis, not semester basis. So we were, and the quarter was nine weeks. And so we painted the fluoride with Durafat on the tooth, measured it in the lab, and then measured the ion migration flow across the enamel matrix. And in 9 weeks, how much fluoride do you think migrated into the tooth?
Go on, tell me. Zero, holding up a zero there.
0%. So even if it did work and did anything besides cause mottling of enamel, it doesn't do anything. But it's very toxic because it isn't just fluoride that they're putting in the water. It's hydrofluorosilicic acid, and it's a toxic compound from the fertilizer industry in Florida. And so these government regulatory agencies are trying to put all of this garbage in, they sell it to get rid of it, and then it just gets dumped in the water. Because why? Oh, because it helps your teeth get harder, and it doesn't. It causes all kinds of, it screws up your stomach acid, for one thing, and it works on the pineal gland. It calcifies the pineal gland. It lowers intelligence. These have all been proven. Lowers intelligence, and it causes mottling of enamel, which is a discoloration of the enamel.
I'd add one thing to that. I'd add one thing to that, Tom, because I did an interview with the professor of endocrinology in the School of Medicine here in Sydney, Professor Cresswell Eastman, many years ago, and he's very focused on iodine deficiency and the effect of that on thyroid. And I posed the question to him because iodine and fluoride are in the same family of chemicals elements. I said, does fluoride displace iodine? Does fluoride displace iodine from the thyroid gland? And he replied, yes, it does.
It replaces the T4 and the T3 conversion in thyroid. So the T4 has to be converted, and iodine has to be knocked off. There's 4 iodines on a thyroid molecule, and there's three fluoride molecules on an active thyroid molecule, and the fluoride interferes with that. It takes the place of the iodine on the molecule, and so you're absolutely right. It decreases thyroid gland function.
And thyroid cancer has gone up, several 100% in the last 20 or 30 years. Thankfully, it's not generally a killer, but it has gone up.
Are you familiar with Life Extension magazine?
No.
You should be. All of your listeners should get on the bandwagon and get a copy of Life Extension magazine. Life Extension, it's very, very, credible source. And what they've done is they did some studies on iodine, selenium, and vitamin D3. And if you're low on vitamin D3, selenium, or iodine, you have a much greater chance of getting cancer systemically, anywhere systemically. So, and most people's iodine levels are just in the basement.
Yeah, I mean, Cresswell Eastman made the point that it's the biggest deficiency in the world. Right. And I would think only second to vitamin D. So you picked out some big ones there.
Yeah, vitamin D is another issue.
Yeah.
So, do you know who has the lowest percentage of vitamin D in the world?
Where?
Iranian women.
Yes, not surprisingly.
Right.
Yeah.
They're covered up all the time.
Yeah. Incredible. Now, you mentioned root canals a few times, and I think this is a very interesting topic. I mean, how does one, because pain isn't always associated with problems, how do you assess whether a tooth needs a root canal? I'm putting the needs into inverted commas.
That's a great question. A CBCT scan, X-ray, and routinely
CBCT means 3D X-rays.
3D,
3D,
yeah,
right.
But you can't always visibly see them on a film.
Mm-hmm.
So you have to. Most people that I've worked on that have had osteocavitations or root canals or failed teeth, they know it somehow. They go, this is cracked, or it's pussy or something. So I think there's very few teeth that I have in the past that I've looked at that I couldn't tell that I think there's something wrong here. And if there's something wrong, then we refer them out for a CBCT scan, and or probably, people they'll have the option. I'm not saying you can't ever do a root canal, but I would personally.
Mm-hmm.
You can, but you need to, if you're going to do a root canal, let's say you have an anterior tooth here and you want to save it. You don't want to take it out. What I would do then is do an ozone procedure and ozonate the tooth, because then you're killing the bacteria, you're killing the bugs and the viruses. Mm-hmm. So I would do that. We had a panel up, a series of 7 ozone treatments that we used, where we just had an ozone generator. And so it was medical grade ozone. We take it up in a syringe and then just inject it into the tooth.
Mm-hmm, mm-hmm.
So, but basically it's determined via X-ray, and I think I got pretty good at reading X-rays after I've been doing so many of them.
I mean, I think we clearly have our contemporaries in our ages, more or less, and I think the use of 3D. This is a really important point for people listening to get. The 3D X-rays have totally revolutionized our ability to diagnose disease in the mouth.
Right.
Would you agree with that?
Yeah, because they're 3-dimensional.
Yeah.
Yeah, I would agree with that. They take a while. You got to go to. Here's the thing: if you're gonna, with your health, you need to work with functional doctors, functional physicians, functional dentists, who are, and get a team of, physicians and doctors and nurse practitioners, et cetera, together, because there's a whole bunch more outside of dentistry, oral decay, et cetera. There's hormonal imbalances, and there's stress, and like you said, and but basically, I would remove a tooth if it were infected.
Well, yeah, I mean, addressing infection. I mean, if you think the common denominator in all diseases, physical and mental, is chronic inflammation and compromised immune function.
Right.
I mean, it's a no-brainer, really, isn't it?
Which produces a compound called nuclear factor kappa beta, NFKB, which blows up all of the inflammatory mediators. But no, I think you're right. I think the 3D film gives you a whole new perspective. You can see, you can take slices of the area and you can see if there's something going on.
Because I'm sure this has happened to you, Tom, that, we grew up looking at 2D X-rays, the familiar X-rays that we always looked at, and we might have looked at something and thought, gee, it's not really very clear. I think we might just keep our eye on that. And then along came 3D X-rays, and suddenly, after 20 or 30 years of practice, we're going, oh my God, have I been ignoring that? That is shocking. Has that been your experience?
Yeah. But whenever we had something, if somebody was suspicious about a tooth, we would just say, well, we can ozonate it. We can just run you through a series of ozone, and that kills all the viruses, kills the bugs, kills the bacteria, kills the parasites, kills, everything that's bad. So then we re-X-ray it again, but then comes along 3D, and you got a whole new ballgame. So
we've talked a lot about infections and tooth decay and gum disease, and there was a WHO report. I might put the plug in here. A WHO report on oral health status globally, and reported that 3.5 billion people in the world suffer from oral diseases,
Three and
which
a half
dwarf
million.
billion, which dwarfs all other diseases combined. And
Is that,
I actually think 3.5 billion is an underestimation,
yeah,
but
I
it's
do too.
shocking enough. Shocking enough. Another aspect
Half
of
the world, half the population of the world.
yeah, and I think that it's got to be more than that. It's got to be
Yeah.
more than that because half the population don't go to the dentist.
Right. Right.
So that's only
And then,
3.5 of half the population
and then
who
as it goes, those people that go once every 6 months. Do you know how that came about? 6 months
go on,
dental appointments.
go on.
Back in the 1950s, there was this toothpaste company called Ipana toothpaste, and Ipana toothpaste had a mascot called Bucky Beaver, and Bucky Beaver said, "Brush your teeth after every meal," which is right, and visit your dentist twice a year, and that became the industry standard. No joke.
uh,
So it's
okay.
based on nothing but Bucky Beaver. And the truth of it is, some people need to go every month. Some people need to go once every 5 years. And I was trying to figure out, how come the people that have great, care and are looking forward to everything, looking at everything they can do to keep their mouth healthy, etc., and their total body healthy, and they still get dental decay. And you have some guy comes in, he smokes, he drinks, he's and he has nothing.
Hmm.
So that always kind of that sort of was a catalyst to get me into oral holistic biological dentistry.
Now, you mentioned some should come every month. And before we leave the infections for a moment, the people that should be coming more regularly is when they have periodontal pockets. Would you agree
Yeah,
with that?
when you're watching something, like or if they're coming in for ozone treatments, or
Right,
they're
right.
coming in for PRP treatments, or they've had they're having major construction on the mandible or on the maxilla,
Yeah, yeah.
which we saw a lot of patients. And so, like I said before, a lot of what we did in my practice was orthodontics. We did early intervention orthodontics, functional orthodontics, which we saw some amazing results, Dr. Ron. Kids,
What was some of those changes that you saw by creating more space?
facial changes. The mandible would come down center underneath the maxilla. Tongue placement. Now they could place their tongue up in the maxilla where it should be, in the palate area. Breathing improved, and decay issues improved, and facial issues improved, and they felt better. They just they lifted up their spirits.
Mm. I
So,
mean, sleep is another area that we've become very
so
involved with in the last
yeah.
15, 20 years.
Say that again.
I say sleep is the flow on, a better night's sleep is the flow on effect from breathing better.
Yeah, yeah, right, right.
What's your view of bruxism, clenching or grinding of teeth? What's the problem there, and what are some of the things we can do about it?
TMD, stress, and muscular
Yep.
issues. The best thing you can do is do functional orthodontics. By functional orthodontics, I mean, most people that did orthodontics would wait let's wait until he's done growing, and then let's fix his teeth, and let's
Yeah.
extract 4 bicuspids. In fact, what I'm saying is, let's just shove the mouth even further back and make it worse than it was. So let's wait to do it. When every orthopedist knows that you can, by pushing on bone, you can make it move. And so but you can't, in orthodontics today, some orthodontists are still saying, they're still using the extraction, what I call 4 on the floor technique for 4 bicuspid extractions. And that just makes everything worse, crowds everything down. So you want to expand out the arch so you can get the tongue to fit up in the maxilla. So they can swallow better, so they can breathe better. And what was the other part of the question?
Bruxism, like
Okay,
clenching.
bruxism is it's when your teeth don't line up. I think that there's muscular spasms that go on at night, and plus, like you said, added with stress. stress, and then the depletion of hormones or the melatonin hormone in the pineal gland because they're doing fluoride. All that stuff is working together to cause paroxysmal, but it's usually a misplaced condyle, the condylar head, which is in the side of your face. The temporomandibular joint is a very interesting joint. It's the most complicated joint in your body because imagine if your knees were locked together and they moved both at the same time, and they moved down and forward and back and upwards. That's what the TM joint does. And so stress is a big cause of TMJ issues. And I think lack of airway space. But the natural remedy, in my opinion, is to go to somebody who's been trained by the IAO, the International Association of Orthodontics, which I went through their program twice. I was never board certified, but I went through their program twice, and I saw so many great positive results from children getting better and just having the self-confidence because they look better. So the TMD is related to all those things.
I agree with you. I always would say that the reason for doing orthodontics that expanded your space, people mainly did it for the aesthetics, but I would argue the main reason by a long way is airway. Yeah,
right. And there's lots of ways you can do it. You can start with small little appliances for kids. Mm-hmm. And then when as long as the time to do it is when they're still growing. So from 4 or say 5-ish to 18, that's when they're in a male. They're still growing. Well, you have up to 21 for females. But I've even done it with adult patients, and it works phenomenally well. Yeah. And it doesn't relapse if you do it slow enough. And then you have to retain it.
It's interesting, Tom. I often would say that the best orthodontic appliance known to man, woman, or child for retention is the tongue.
Yes. Yeah, but you got it fitting into place first, right?
Yeah, you've got to get tongue function right. Yeah. Now, listen, you've thrown up so many things, and we'll, of course, have links to your book, Matters of the Mouth. But if you wanted to leave our listener with a couple of, they're thinking, wow, this oral health thing really is something I need to take a lot more seriously. What would be a couple of hints you would have for people to ensure that their oral health was optimal?
Well, I would say I've got a list in the book. It's 10 ways to get rid of your dental issues. And the first thing is make sure you have no gingivitis. Get your teeth checked for periodontitis. Get the 3D scan, like you said. Get rid of your mercury fillings, but only with a dentist who does biological removal of dental silver fillings. And then look at your teeth. Make sure that they're straight. Even if you're an adult, you can still fix them, but you have to retain. You have to go into some kind of retention, which is not a big deal. And then make sure you have no infections. Check your microbiome. Make sure that your pH is basic and instead of acidic. And then there's a list of to-do things in the book about a list of 21 things to do. How to clean your teeth. Use a Psycare. Use our product Oxymist and Silodin, and use our toothpaste because our toothpaste boosts nitric oxide. There's 5 ingredients in our toothpaste that boost nitric oxide synthase, and that's on pearloralhealth.com.
Well, Tom, thank you so much for joining us today and sharing your knowledge and wisdom. Thank you for being here.
Thank you.
Well, it's always interesting to connect with a contemporary, somebody who has been in practice for as long as I have been. We both have been in holistic dentistry for over 40 years. Clearly, our approach to it was very different. 9 chairs, 80 patients a day. That is just head-spinning stuff for me. It's not the way I ran my practice, but hey, this is the way Tom ran his. But the points that he makes are so important, and alerting you, a dear listener, to this important point. This will be, as I often say, of interest to anybody with a mouth who is interested in their health and has never fully connected the two, because the connections are truly surprising and quite profound. Not just is dental decay and periodontal disease the two most common diseases in the world globally. I mean, you think mental health's a big problem. Well, 1 billion people suffer from mental health problems. This is according to the WHO recent report in 2022. Cardiovascular disease, the biggest killer. 500 million people globally suffer from cardiovascular disease. Cancer's not dissimilar. Diabetes also very high up there. But 3.5 billion people suffer from oral diseases of tooth decay and gum disease. And and it's worth saying that those diseases are connected to every one of the others: cardiovascular disease, cancer, autoimmune conditions, diabetes, and even mental health. Yes, even mental health, because the common denominator is chronic inflammation and a compromised immune function. And if you've got a chronic infection that you don't know about, it is causing chronic inflammation and a compromised immune function. That requires a comprehensive oral exam, which in my experience always took, when I initially saw a patient and when my practice, which I'm no longer associated with, the Sydney Holistic Dental Centre's new patient exam, would always take an hour to do a comprehensive oral exam. And if there was a complex history, if you've had a lot of fillings or crowns or root canals done, then a 3D X-ray or a scan to assess the infections and the health of the bone and the teeth and the sinuses is all part of what a comprehensive oral exam is all about. And I thought it was also interesting that Tom said some people need to come once every 5 years and some people need to come every month. And if you have periodontal disease, meaning pockets that you can't get to the bottom of to clean on a daily basis, then seeing your hygienist or dentist every 3 or 4 months is absolutely vital, because the research shows that after 12 to 16 weeks, the microbiome at the bottom of that pocket that you can't get to starts to become more pathogenic, meaning causing more diseases, not just around the tooth, losing bone, but affecting all the other parts of the body. So the body is connected. It's a big breakthrough in medicine. It's happening, folks. Holistic is not some new age philosophy, just happens to be the way the body works, happens to be the way the planet works, and they are all connected. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness, from self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.